this coordination will go ahead in the days if the epidemic is eventually declared as a public health emergency of international concern. It hasn't been as yet. And then it will deepen. But we felt, based on advice from the Caribbean Public Health Agency, that we actually needed to have this forum immediately. And it was mostly to put accurate information into the public domain. And so when you look at this panel, we are speaking with one voice with the Caribbean Public Health Agency. And we have a chief medical officer representing his country as well. We speak with one voice on these matters, and that's very, very important. And what you will also see is that the university will give its capacity where it has capacity to countries when it is asked. So this was particularly evident in the Zika epidemic when, for example, in Jamaica, and our next speaker will be from the microbiology lab of the hospital, where we put the capacity of the laboratory at the service of the country. And Zika tests were carried out by that laboratory. And I have no doubt that that laboratory, as soon as the primers are available for to them for the coronavirus, that they will put that laboratory at the service of the country as they did before. And I want to just end with the importance of building laboratory capacity in the region to handle these kind of outbreaks. Because when you have an outbreak, decades ago, we would have had very limited capacity to do any kind of viral detection. So the famous HIV epidemic actually has given the Caribbean quite a strong capacity now for measuring viruses. So the same labs that were often set up and developed to combat HIV, they're now being put towards detection of influenzas, seasonal influenzas, pandemic influenzas, bird flu, any number of viruses of concern, including human papillomavirus, the causative agent of cervical cancer. So our viral detection capacity has increased, and with every epidemic and with more coordination, it gets stronger. And it's important that we build our own indigenous capacity to carry out laboratory testing, because that's what's needed, particularly in a fast-moving epidemic. So let's say you have a visitor at the airport or in the community who is showing some symptoms. You need to be able to identify this person as quickly as possible. Do they have the virus of concern or not? Can you eliminate them, or do they need to be put into quarantine? And we need to have that answer quite quickly. And so in the past, sometimes our viral detection capacity has been quite limited, and we've had to send viruses off to a referral service made available to us through partners. And that time lag, and also the minimum number of samples that we're permitted to send, makes it difficult to get on top of an epidemic and to give accurate information and to build that element of trust that's needed. It's the cornerstone of the public health response. So I really do want to indicate that building our own indigenous laboratory capacity is very, very important. And I do chair a Caribbean professional society called the Caribbean Cytometry and Analytical Society. And we published a paper showing that if you take the long time span of 10 years, you can show that the Caribbean is gradually building more and more and more capacity, particularly to detect viruses. So we're not sort of completely where we would like to be, but we're moving in the right direction. And I think this will really help to underpin our responses going forwards.